government is offering to evacuate Australians trapped in the epicentre of the coronavirus outbreak. The Coalition's plan is to quarantine them on Christmas Island for 2 weeks. For more on this, I'm now joined by Dr. Sanjaya Senanayake, an Associate Professor of Infectious Diseases at the ANU. Doctor, thank you so much for joining me this afternoon.
Oh, thank you, Danica. Happy to be here.
Firstly, what are your thoughts on the government's plan?
I think it's good that the 600 people are able to be evacuated, because it must not be a pleasant time to be in Wuhan. There must almost be a siege mentality with all sorts of psychological effects. So I think coming out of Wuhan is good. But of course, you've got 600 people who have to be watched very closely. And I think if they came to the mainland and went to their own homes, there'd be a couple of risks there. The first one being is that now we know that this virus can be transmitted when people don't have symptoms. So sending people to their own households with their family would be putting family members at risk. And also it'd be a big strain on public health resources to have 600 extra contacts all of a sudden. So I think putting them into one facility where they can be monitored for 14 days in a humane way, of course, is a good idea.
Given that it is only a planned 2-week quarantine period, is that long enough to keep the rest of Australia safe?
Then as this outbreak goes on, we're learning more and more about the virus, and there's still a lot we don't know. But at this stage, we think the incubation period is up to 2 weeks, so 14 days should be enough, but watch this space because things are changing so rapidly.
We've heard that Australia should brace for more potential cases here. Are we ready for that?
I think so. I mean, we have isolated, I think, 7 cases now. We've got a robust public health infrastructure and well-trained border protection services for this kind of thing. We've unfortunately had to deal with SARS, swine flu, Ebola, but the pandemic exercise planning for that has helped us for something like this. So at this stage, I think we're doing okay.
Is there any concern that this disease could spread from asymptomatic patients?
Yes, and that has recently come out through a Chinese traveller who went to Germany for business and didn't have symptoms at the time and only developed symptoms on the plane a couple of days later when she was returning to China. And some of the workers at the workshop she was at developed coronavirus. So it does look like there is transmission of the virus when someone has no symptoms, so it can occur.
As you said, we're still learning more about the virus itself. How worried should Australians be?
I think the potential for this virus to spread is still there. As I said, at the moment, we've got the robust public health infrastructure and border patrol to try and identify people. So I wouldn't be at panic stations at this moment by any means, but certainly if we start to get cases and then local transmission that's sustained in Australia, then we have to worry more. The vaccine would be very helpful, but that's a long way away, it looks like.
Is this an unprecedented situation? And we've seen other viruses in the past that have come and gone, but is this particularly out of the ordinary?
No, look, since the 1970s, we've had about 40 new infections appear. This is another one of them, but I think because of a few factors, the Lunar New Year and the mass migration within and outside China, it's allowed this to spread. So it is certainly an unusual event and a very memorable one, somewhat like SARS. And unfortunately, there'll be more, I suspect.
And overall, what would be your advice to people in Australia? How can we protect ourselves?
I think right now, just rely on our border protection services and public health services to control the outbreak. Of course, the advice will change if we start to get transmission within Australia. And if that happens, as it is in China, then avoiding public gatherings, wearing masks when going outside, particularly to public gatherings, and good hand washing, because contaminated surfaces could potentially transmit this virus. All those things are really important. And of course, if you're sick, to stay away from other people and practice good cough and sneezing etiquette.
Some great advice there. Doctor, thank you so much for your time this afternoon.
Thanks, Danica.